near past and the distant past, you know, different times on different things. And then pledging support that if there's anything that we can do, because our organization has changed a little bit, so we've kind of retooled and we have maybe a different direction than we knew about before. We can touch bases so we can understand where we're going and then how we might be able to align with some of the projects that everyone else is doing the same thing too. And that's what I think makes the forum great, is that there are a lot of resources that we can choose from within the membership to try to help drive our initiatives and programs forward.
So this is exactly what I want to get. Tell me when you're ready. I know.
I'm recording now.
Okay, so let's start off. I'm going to ask to say your name, my name is, and your affiliation position.
Okay, sure. My name is Paul Underwood. I'm a medical director with Boston Scientific Corporation on their Close the Gap program.
Great, thank you for being here. One of the things I wanted to ask you was, what is the value of a big corporation like Boston Scientific? What is the value of the National Forum for a big corporation like?
Just to make sure, look at her.
Oh, I'm sorry, I forgot. I forgot to ask you. Look at me,
Mm-hmm.
camera. Okay. So let me start over. So what is the value of the National Forum for a big corporation like Boston Scientific?
Well, certainly a large corporation like Boston Scientific has many irons in the fire, and understanding very well how our patients are and how people who use our products receive our products, the barriers that they may face to getting care, is extremely important. The forum allows us to have a voice from the patients, from the patient base, the advocacy base, to understand how we can better serve them. So really, the forum brings to us many unmet needs and allows us to participate in overcoming some of those challenges through collaborations.
Mm-hmm. And what makes the National Forum worth your time coming all the way over here for this meeting?
A lot of the people that we work with already in our field, so with Close the Gap, we are visiting with hospitals, educating healthcare practitioners largely on culturally competent therapeutic area awareness. So understanding how stroke affects, minorities, African Americans more so than whites, and things that are nuanced in taking care of people who may have barriers to access to care. So we're out in the field quite a bit, and the people who are part of the forum are also out in the field quite a bit. And our paths overlap. What we try to do is to give some direction to what our hospital partners are doing. And so knowing that, say, public health departments are really, we're all in the same field, but how we're doing it may not be aligned. And so Close the Gap and the National Forum can partner, and the partners within the National Forum can be engaged in local activities. And that's, I think, the value that we see it, particularly with our Close the Gap program.
I want to go back to what we were starting to talk about as you're getting your mic on. The whole point of us trying to talk to everybody is to get the word out about the National Forum,
Mm-hmm.
what it is, and why it's important to have a place to collaborate on this important on heart disease and stroke prevention. So, if you could sort of tell me a little bit of that in your own words, why it's so important to have this space.
Well, certainly one agency is not going to be able to do it all their own, and it's going to take a collaborative approach to make sure that we all have optimal health. And, everyone has equitable health. The health is promoted to the highest level. So we have to learn how to link with others and understand the overall playing field that we're dealing in. And I think that there's a lot of expertise in, say, the federal playing field, the state playing field, municipal playing field here. There are a lot of activities that take place either within industry or within other agencies or associations that are interested in that area. So it's very important that we are kept abreast of what's happening. So for us, it keeps us up to date on, say, Million Heart, what's happening on a national level or a global level, and then specifically what some of the projects are that we can be aligned with. And that's a key characteristic that I think we find for our group, because we can be very business oriented and just look at product sales, distribution, but to understand what the impact actually is when people are involved is something that the forum brings to us. And again, it allows us the opportunity to partner with people who have an interest in those areas already, that we can perhaps make them stronger. We can use their collaborative efforts to help us with our direction and push our mission forward as well. That's really a large benefit here, and as I've been a member longer, I've had the opportunity to have worked with several other members for different projects at different times in different places. And so it just keeps on continuing and continuing and continuing. Now I have many more hands to shake than I did when I first came here. We've had many more high fives on different projects that we've done in different places. I get a lot more updates because I've interacted with different people in different areas. And so it's really a good time to get to gather this body and to share information.
And what big takeaway are you going to take take home from this meeting? What kind of message would you send to those who who aren't at this meeting? Is this a must-attend event?
It is. Certainly, I encourage people to become part of the forum. And fortunately, even with this visit here, there are new people that I have recommended to come. So at least that those individuals are responding to it. I think this is a very good networking opportunity for individuals who are in this field. And so I invite them to become members as well. Certainly the big takeaway is that we do have quite a bit of work ahead of us. Unfortunately, we battle with cancer in terms of who's going to be the #1 killer of Americans. And even though we've made tremendous headway, cancer has made tremendous headway as well. So we need to try harder to reduce the reduction and the decline in heart disease and stroke. And I think it's been made very apparent, say for Million Heart, that perhaps we're not reaching our goals on stroke. Just as last year we heard more from heart disease that, well, I guess Million Heart again, but that we're not reaching our goals overall for cardiovascular disease. And to understand what new tools and resources are available for us, more best practices, say things to avoid, feedback from other programs in other ways, the forum kind of brings that together so that we can get our direction for the next year. So I think it's very important that we're all aligned. We all speak the same language, just as Dr. Adams said, we all speak the same language, and we don't have to necessarily walk in step, but as we move out, we know that we have partners that we can call on, and the partnership comes from the forum, basically.
Wonderful. That was great. Thank you.
Okay,
very
great.
much.
You're very welcome.